Dr. Jay Lemery. He's going to tell us about an exciting fellowship in climate and health policy. Dr. Lemery is a professor of emergency medicine at the University of Colorado School of Medicine, chief of the section of wilderness and environmental medicine, and he's faculty in the Department of Environmental and Occupational Health at the Colorado School of Public Health. He's also the past president of the Wilderness Medical Society.
Great, thanks, Lisa. I just want to take a very short amount of time to introduce our collaboration on the Diploma in Climate Medicine. As we're hearing increased calls to scale up the climate savvy professional healthcare workforce, we at the University of Colorado School of Medicine, building on our GME Climate and Health Policy Fellowships, will launch the Diploma in Climate Medicine this fall. In partnership with the Medical Society Consortium, the Climate Central, and coordinating with the National Medical Association. This diploma, offered by a School of Medicine, is meant to be a heavyweight credential for credibility, knowledge, and leadership in the field, open to all healthcare providers. So as we say, if you touch a patient, this program is for you. It's modeled on other diploma programs like the Diploma of Tropical Medicine and Hygiene. It's a 300-hour program. It's broken up into 5 one-week modules and will be offered over 18 to 24 months and delivered in a hybrid fashion of remote and in-person. 5 diploma courses, separate ones, will include 1, climate and health science policy, 2, environmental justice, 3, healthcare system decarbonization and resiliency, 4, workforce training, and 5, climate and health research and dissemination. We want a visceral experience for our learners, and by example, the first course will include climate and health weather modeling exercise at NCAR, National Center for Atmospheric Research in Boulder, and then we'll go to Rocky Mountain National Park with National Park Rangers to get an up close and personal of climate-driven ecosystem stress. I'm also very pleased to announce that Ed Mavak will be our featured faculty with us here in Colorado for diploma course number 1. So in summary, the Diploma in Climate Medicine, it will offer the superlative distinction for expertise in this novel field and a powerful credential for graduates to assume leadership positions, which we know are coming. I'll share the website in the chat, and please reach out at any time to hear more. Thanks for this little moment to connect with you on this. I'm going to now pivot to introduce our morning's first speaker. I have the privilege to introduce the first session of the day, Addressing Air Pollution Nationally, Locally, and in the Clinic, featuring, sorry, one sec.
Jay, we are actually miraculously a little early for once.
Okay, cool.
We were so efficient with our time. I think have Laura and Kari joined us yet?
They're in the backstage room, but they're coming back right now.
I had the fear of Colin in me, which is like, do not go long. Do not go long.
I know. Thank you, Jay.
Jay, maybe I'll just ask you a couple more questions about the fellowship that you can answer for folks that are listening in. How many years has the program been going now?
No, it's just started. We've had the fellowship which is an intensive program for individuals. That's been going on for 5 years. We just scaled it up to 5 fellows a year. The diploma was really meant to fulfill that niche for people that said, hey, look, I'm a dermatologist in Tampa with 3 kids, 10 years out of practice. I want to get involved. I want to dive in. I can't do your fellowship, which is like a half-time job with formal preceptorships. And so we leaned on what we knew was out there. We leaned on a little bit of what some of the credentials that people do in wilderness medicine. We looked at Trop Med and Hygiene, which is a very well-established credential. And we talked to our dean, and it's like, we need to give a diploma. It's more than a certificate. And we have to do this. We need a heavyweight credential for people to be able to raise their hand and be like, I'm the person, dean, CEO, executive director, to run the decarbonization or to lead education in our institutions. And so this is meant to give our healthcare providers that heavyweight credential to say, I'm your person, sign me up, and give them that credibility and confidence to do so.
And can you tell us a little bit more about logistics? So how much does it cost and how long does the diploma process take?
Yeah, so the first course is $3,500 for physicians, $2,900 for non-physicians. It's a combination of remote, asynchronous, and synchronous, and in person. Each week, we've designed it for busy clinicians. So it starts Sunday night, you wrap up in wherever we're going to go. The first one's in Colorado. We have other places we want to get to for the other ones. You wrap up Saturday night. And so the idea is, and you don't travel until the middle Wednesday. So if I could just go through with you, do some pre-work, start Sunday night asynchronously, fly Wednesday, hit the ground running Wednesday night with a banquet, done Saturday. So it's really designed to make it efficient for busy clinicians, but at the same point, we know we're going to want to give people a value proposition. So we want to have hands-on, bring in expert speakers, and this is the first one with like Ed, and really spend time together networking and really diving in and learning some of these core concepts.
Awesome. Thank you so much for the additional detail. I think we're now ready for our next session. Is that right?